the progress, expanding opportunities. The agenda of the Congress also highlights issues such as inclusive care economics, and also this amid the world and regional challenges taking place nowadays. Also, the meeting addressed the global health challenges, demographic dynamics, women empowerment, social protection, economic justice, lifelong learning, fertility trends, migration, digital innovation, along with
دولة رئيس مجلس الوزراء دكتور مصطفى مدبولي، معالي الوزراء، السفراء، السيدات والسادة، الحضور الكرام، نرحب بحضراتكم مجددا في النسخة الثالثة من المؤتمر العالمي للسكان والصحة والتنمية البشرية 2025. ننتقل مع حضراتكم الآن إلى أولى كلمات ضمن جلسة بعنوان رؤى عالمية حول السكان والصحة والتنمية البشرية، والتي تجمع نخبة من المتحدثين المتميزين يقدمون رؤى مستقلة من زوايا مختلفة. من خلال كلماتهم سنكتشف معا التحديات والفرص التي تشكل السكان والصحة والتنمية البشرية.
Let's welcome Mr. Jagat Rakash Nada, the Minister of Health, India. Please proceed to the podium. Thank you very much. فخامة رئيس وزراء جمهورية مصر العربية، فخامة نائب رئيس الوزراء ووزير التنمية البشرية والصحة والسكان، السادة زملائي وزراء الصحة والسادة الزملاء، أولا أود أن أحييكم وأحيي رئيس الوزراء ونائب رئيس الوزراء على نجاحي في هذه الجلسة الافتتاحية للنسخة الثالثة من المؤتمر العالمي للسكان والصحة والتنمية البشرية. وأود أيضا أن أحيي فخامة رئيس الوزراء ونائب رئيس الوزراء على الرحلة الناجحة في مجال الصحة، وذلك بقضاء على
I would also like to congratulate and commend for the hard work which has undertaken by the Republic of Egypt, for which the WHO has certified that trachoma is now no more a public concern. And I'm also very happy to note that Republic of Egypt is working hard to address the issue of malaria. So, keeping this factor in view, I can understand as a health minister, to get these achievements achieved is not an easy task. And so once again, I congratulate the Honorable Prime Minister and the Deputy Prime Minister for the achievement which they have taken. I am also delighted to address this gathering at the third edition of the Global Congress on Population Health and Human Development, organized by the Ministry of Health and Population of Republic of Egypt. I am honored to be here in this historic city of Cairo, and I am deeply grateful for your warm welcome and hospitality. India and Egypt, two of the world's oldest civilizations, share a long history of cultural civilizational ties which has blossomed into an exceptionally close relationship, a testament of friendship and solidarity between our two nations. Excellencies, healthcare stands as a cornerstone of the India's-Egypt strategic partnership. Our nations face public health challenges and share common goals, ensuring equitable access, quality and affordability healthcare for all. Despite the challenges we face, both countries have made significant strides in successfully advancing universal health coverage and strengthening our healthcare delivery systems. I would also like to take this opportunity to congratulate Egypt on its remarkable achievement on various fronts. I am also happy to note the achievement by reducing the cost of hepatitis B vaccine 80% of the market price. We continue to extend our support through export of active pharmaceutical ingredients, API, and bulk formulations valued at over $210 million to Egypt in the fiscal year of 2024-25, providing critical inputs to the growth of Egypt's pharmaceutical manufacturing sector. Excellencies, under the dynamic leadership of Prime Minister Shri Narendra Modi ji and under his visionary leadership, India's commitment to the universal health coverage is reflected in the implementation of the overarching flagship program Ayushman Bharat, which reinforces the pivotal role of primary health care in ensuring equitable, accessible and affordable essential health services for all citizens. As a part of this initiative, India has made substantial investments in primary health care, recognizing it as the foundation of a resilient health system. Under this program, around 180,000 Ayushman Arogya Mandirs, which are the primary health and wellness centers, have established across the country, delivering comprehensive primary care services covering maternal and child health, non-communicable diseases, and essential drugs and diagnostics, ensuring that these are provided free of cost. Under this initiative, India has also launched the world's largest government-financed health assurance scheme, Pradhan Mantri Jan Arogya Yojana, PMJ, providing financial support of around $6,000 per family per year for secondary and tertiary health care. Till date, over 420 million beneficiaries have been covered under this scheme, ensuring access to quality health care without financial hardships. This scheme now being extended to cover all citizens over 70 years of age, irrespective of their socio-economic status. The Ayushman Bharat Digital Mission innovations have strengthened our efforts by creating a unified digital health platform with nearly 800 million health accounts, enabling citizens to securely manage and share their health data across providers, ensuring continuous health care. Excellencies, guided by the vision of our Honorable Prime Minister Shri Modi ji, India's digital health initiatives continue to play a transformative role in strengthening the public health delivery. One such initiative is UWin, a digital platform developed for the recording and reporting of every vaccination event under the Universal Immunization Program. The UWin portal provides a fully digitized record of vaccination for pregnant women and children from birth to 17 years of age, ensuring complete lifestyle tracking and improving service delivery and accountability. Complementing this, the Electronic Vaccine Intelligence Network, EVIN, has revolutionized vaccine supply chain management by enabling real-time monitoring and digitization of entire cold chain system. Together, these initiatives promote data equity, transparency, and efficiency in immunization programs nationwide. Excellencies, to further reach to our health services, our Honorable Prime Minister Narendra Modi ji launched Swasth Nari Sashakt Parivar. This Abhiyan, which translates into Healthy Women Empowered Family campaign. In September 2025, this unique 2 weeks campaign was a nationwide initiative focused on enhancing healthcare services for women and children. The outcomes of this campaign reflect rapid, targeted and inclusive action demonstrated by the fact that 5.44 million pregnant women received antenatal checkups, while 12.80 million children were provided with life-saving immunizations. In addition, 9.30 million individuals were screened for anemia, 14 million citizens were screened for hypertension and diabetes, thereby advancing non-communicable disease agenda through preventive health care. Further, 3.10 women were screened for breast cancer and 1.60 million for cervical cancer, integrating women's health into broader framework of universal health coverage. The campaign has screened also 5.80 people for oral cancer and 7.10 million tuberculosis, reaffirming India's commitment to early detection and elimination of major diseases. These efforts reflect India's sustained political commitment, innovation-driven approach, and strong community engagements. India successfully eliminated polio in 2014 and maternal and neonatal tetanus in 2015, receiving WHO certification in 2016. Further recognizing these achievements, India was honored with the Measles and Rubella Partnership Campaign Award in March 2024, acknowledging nation's continued leadership and dedication to safeguarding child health and advancing global immunization goals. The country has proudly maintained this status for over a decade. India has also been awarded the WHO certification of elimination of trachoma during the 78th session of the World Health Assembly in 2025. Excellencies, we look forward to forging stronger ties that will benefit both our nations for years to come and setting an example for regional and global cooperation in health. Let this event mark a new chapter in India-Egypt partnership grounded in innovation, mutual learning, and commitment to build resilient, inclusive health systems and leaves no stone unturned. Thank you. Dhanyavad. Shukriyan.
Thank you, Minister of Health of India, Mr. Jagat Prakash Nada. Now, ladies and gentlemen, with the speech by Jalila bint Said Jawad Hassan, the Minister of Health from Bahrain. Please go ahead.
معالي دولة
Minister
الرئيس
Prime
معالي
Minister,
نائب رئيس مجلس
the
الوزراء،
Deputy
أصحاب
Prime
المعالي
Minister, ladies
والسعادة،
and
الأخوة والأخوات،
gentlemen,
الحضور
the
الكريم،
attendees.
أسعد الله مساءكم
Good
بكل خير والسلام عليكم
afternoon and
ورحمة
peace be
الله
upon
وبركاته.
you. I
يسعدني
am
ويشرفني
delighted
أن
and
أكون
honored
بينكم
to be
اليوم
among
في
you
القاهرة
today in
الجميلة.
Cairo, the beautiful city, the land of civilization and culture, in this very important event that is held under the auspices of His Excellency President Abdel Fattah al-Sisi, the President of Egypt, to represent the Arab state spirit in its best image. And I'd like to convey the greetings of all the Bahraini people, and it's a milestone of the initiative that pays special attention to the health of individuals under the auspices or under the slogan of unlocking opportunities. It's a very important message that reminds us of our collective responsibility in building a very just community where the promotion and prosperity is a common goal and the pillar of any human development. Our region is passing, and the whole world is passing through a transformative stage where there are a lot of issues of population that intersects with the digital revolution, and there's great advancement in this field. And amongst this, there is a potential or reality that's imposed, which is the presence of the artificial intelligence. So it's not only one technology that is present in the labs, it's an effective role in passing judgments and reaching effective health care. Artificial intelligence is not only dealing with data, but its potential is very important to improve the standards of human beings when it's used wisely and with responsibility. In Bahrain, we totally believe that technology is not only measured by its advancement, but its reflection on the prosperity of human beings. That's why we have used the AI as a tool to serve human beings, not only to accelerate tasks, but now our digital healthcare is covering all the hospitals, pharmacies and clinics in a very comprehensive framework supervised by the government, by the national system for monitoring, so we can have the history of the patient in details and to reach prescription and medical decisions based on data. The AI in this system has changed to a very important guard to highlight the factors and to enhance the health services with its all implications in its analytical data and the management of resources. Bahrain has succeeded to jump steps to improve the results in the health sector. So technology is not replacing doctors, but it's assisting tools to save time and to reach results and to support and to provide hope in cure. In Bahrain, investment in AI is not only about medication, but it's also for prevention and for anticipating, and that we can anticipate the outbreaks. The outbreaks of epidemics, and also to define marginalized stratum and to provide preventive medication. This is it was very important in facing COVID-19, where the electronic platforms has provided a lot of data that limited the consequences of this COVID-19. We believe that technology without We believe that in the using AI, it's very important to guard all this. The government in Bahrain is playing a very important role in this field by monitoring the quality of the health systems and safeguarding and privacy of data, and also to safeguard all the data. Dear colleagues, when we talk about AI, we are talking about a very common responsibility that surpasses technology to the ethics of human beings. From our experience, we can say that there are three pillars where any digital system in health should be based on. This is reflected, was said in this opening session of this event that was presented by ministers from Egypt. First, that the human is the core of any digital system. Any advancement in technology will not take the place of human beings with its mercy and knowing the needs of human beings. The doctor and the nurse is the essence and the spirit of any health services, and the AI just help them to provide or to give their sublime services. Secondly, investment in knowledge and in the potential building and in of human beings is the real investment, and this is what Bahrain is pursuing through training courses that mingles all the digital information and health background to have a new generation of healthcare that are responsible and are aware. Third is that to enhance the international cooperation, because cooperation in the field of digital services cannot be done individually by any country. There should be an exchange of information and expertise to unify the services that can be held by the AI. We can have an Arab AI system or a digital system that's based on the cultural and human common values. This conference or congress is not regional, it's a global congress with all the expertise available here, and it represents a good opportunity to enhance such cooperation and to draft common policies that guarantees that the Arab region and all the world are partners for the promotion of health. Technology alone cannot work alone, but should be translated into reality that every person can feel. The real success is measured by the care for the young children and the old people who can help him anytime and to prevent diseases. And this is have the trust in our health systems where there is mercy. This is the real image of the human innovation, when the AI works with the human dignity in a balance between digital world and human world. In Bahrain, we continue and we pursue our endeavors to review and to reassess our services, but we have values that is to serve every person, and that we also participate in the international and regional dialogues in the field of health and AI. I'd like to conclude with a vision where we can see the future. If the 20th century is the century of the health innovations and discoveries, then the 21st century is the century of the human AI, that AI mixed with the humans for the service of humanity. So it's not innovation only, but only to make innovation as a bridge for mercy and to achieve the human dignity. Bahrain is extending its hand to its partners all over the world and in the Arab world to build bridges of knowledge and exchange of expertise during platforms, and like today, such as today, to reach a world more healthy. We ask God to have this event as a new chapter for a new common endeavors for the health and human development. And that at the end, I'd like to thank Egypt for the hospitality and the good organization. And I wish you all the success and to come up with recommendations for the sake of the development of humanity.
Thank you so much, Your Excellency, the Minister of Health al-Bahrain, Jalila bin Jawad Hassan. Now, ladies and gentlemen, distinguished guests, with the speech of Dr. Abdullah al-Dardari, Assistant of the General Secretary and UNDP. Please, sir, the floor is yours. Your Excellency, the Prime Minister of Egypt, Your Excellencies, ambassadors and distinguished guests, it's my pleasure to be in front of you today to tackle a very important topic, which is the human development and its relation with the economic development and technology in our Arab region. We came to Egypt, and Egypt achieved in the So we can see an enhancement in the financial affairs and in managing the internal and the foreign debts, and we can see a huge increasement in the direct foreign investments and also in the Egyptian exports. All these indicators reflect and show a very promising economic future, and we would like to assure that this part of the human development is part of the economic performance, because the indicator of the human development, the Egyptian human development in the past years was not up to the national GDP. Maybe this equation is a little bit difficult, but we have to work on it. And I think that the existence and the presence of the economic ministers, it's a very good start for networking between the economic and the financial performances and the human development performance. Also in the Arab region, there is a kind of improvement in the human development, but this indicator is a little, it goes back a little bit, because and the national GDP is more than the share of the citizens in the national GDP. For this reason, we still have some structural challenges in the economic composition in the region. The challenge that we face in the Arab region is the productivity, which has a direct relation with the human development. The productivity in the Arab region from the year 1980, it goes back to more than 30%, and this led that the share of the Arab economy from the international economy, it actually was reduced to 50% in spite of the $1 trillion income from the oil. So we can see that it's not an Arab phenomenon only. If you read the Draghi report about the European economy, we can see that it is the same in Europe, which is one of the main reasons for the European economy. From where comes the productivity? It comes from an educated person, that his health is good and that he is capable of innovation, and he owns the financial and the financial resources and can participate in the world of artificial intelligence that was tackled by Her Excellency. Our region, unfortunately, is considered to be the most weak region, and we followed up in the UNOGP all the performance of the youth, the Arab youth that participated in the competition, in the 70s. Where are they now? They are out of the Arab region. So if we are not able to attract those youth to come back to the region and to innovate and create, and we try as much as we can to prepare a proper environment for them. And I would like to say that the problem is not in the revenue. The productivity is the entrance of competitivity, and there are many relations between productivity and the variable economies. So still is not that high in our regions. What we are witnessing in Egypt in such a variety in the economic activities is actually very very promising. We can see an increasement in the service sectors. So Egypt is able to be one of the leaders in the region and one of the models that is capable of investing in the scientific researches and development. This is very important. If you allow me, the topic of investing in the scientific research, we are still investing 0.02 from the national GDP in the scientific researches, comparing to 2% in Europe and 4% in Israel. So the region don't invest in the scientific research, and actually the scientific research is the key to competition and to development. And here I would like to refer to a very important point, that the biggest economy is still the smaller than the level that we need for the investments in research and development. We need the economy of scale in order to reflect the required value of investments. The biggest economy is smaller than explaining this, and for this reason we need a kind of regional integration to invest in research and development that goes from Morocco to El Bahrain, and even this market is not up to the required investments in the research and development. As you know, one model for learning language model in artificial intelligence, the cost is $1 billion just to implement one program. And for this reason, we need investments, big investments in the region and all over the world in order to have economies of scale that reflect the investments in the research and development. We in our region, if we introduce the artificial intelligence, we will be able to create 200 million job opportunities in the coming 10 years, or to lose 200 million job opportunities. We can add a lot on the national GDP, or to lose $200 billion in the national GDP. We have to have a paradigm shift, how to connect between the economic development and the human integration in the heart of the financial and the economic activities in the country. And for sure, the UNODP is your partner in Egypt and in the Arab region to participate in achieving these objects. And thank you so much. Thank you so much, Dr. Abdallah Al-Dardari, the Regional Office Manager of UNODP. Now, please welcome Mrs. Laila Becker, the Regional Manager for UNODP. Please, the floor is yours. وانا هتكلم على قناه واحده ولا ايه اللخبطه اللي هي جت عملتها لي؟
هم اللي قالوا لها،
يعني
حد قال لها بره.
كله على قناه واحده
تقريبا شكلها كده.
أتمنى أن ترجع بي الانعكاسات بعض الآمال. عندما التحقت بالأمم المتحدة فإن تعداد سكان العالم وصل إلى 6 مليار فرد نسمة، وبالتأكيد نحن
and poverty. The awareness on the impact of climate change was just beginning to emerge, and the scale and devastation of conflict had not been to what it is today. We also weren't coping with pandemics such as COVID. And yet, all of these challenges were still amenable to what the multilateral system could offer in terms of alleviating that. In response, the 194 countries that make up the United Nations committed to what would then become the 17 Sustainable Development Goals and a collective promise to work on the backslide on poverty, to reassert equality and good governance as the cornerstones of peace and prosperity, and to preserve the future of our planet. Here we are in 2025, and the planet sits at 8 billion in the space of what is a single generation. And population has been skewed. The narrative has come to become one of challenges, or even worse, where population is seen as a burden. It can be polarized as a factor that is divisive and no longer seen as the asset which we all in this room believe it must be. For the last 80 years, the United Nations has been recognized as the foremost platform for multilateral diplomacy and to address these common issues and challenges that we face. Indeed, our charter begins with "We the people," and I come to you in that spirit of universality that continues to define us. Since then, an entire generation in this 21st century has grown up with rapid technological, social, and demographic changes. A generation that has witnessed at the turn of the century the realization that diplomacy was crucial to address the common concerns of humanity. Engaging our youth and seeing this generation, irrespective of where they may come from, and enabling them with the opportunities that were so well articulated this morning, that go from birth to becoming a productive member of society and using informed choice for their own reproductive health and decisions to become responsible citizens, is that part of our strong future that we all aspire to. So today the world is wealthier, healthier, and more connected than ever before. We see that with all of the technological platforms that we've witnessed. And yet there is a paradox. You heard this morning on the poverty rates. 10%, a full 10%, nearly 1 billion people of our world today live under the poverty line and cannot meet their basic needs. This is why convening this global Congress today is paramount, and a landmark opportunity that I thank the government of Egypt for hosting, and to reaffirm our commitment in linking the dynamics of population health and human development as the foundations to achieving our 2030 goals. I spoke of digital technology and where technology can play a positive role. You've heard from the speakers before me how digital technology has revolutionized many areas of health. It's also revolutionized the conduct of many of the ways that we collect data, including on population and housing census, resulting in data that is insightful in its analysis and the use of that data in planning and decision making. Further advances in digitalization for administrative services, as the ministers before me also spoke, and my colleague Abdullah, that have helped us in revolutionizing the civil registration system, opening opportunities for transitioning from just field data collection that took many hours and was fraught with many holes, to a register-based database or combined census methodologies among several countries in our region. So let me give you some good news. We talked about the challenges. Let me illustrate some of the good news that we have. In Iraq, I'm proud to say that last year, after 37 years, nearly 4 decades, we were able to conduct the first census. That census now is being used by all of the line ministries in the planning and informing how they can meet the population demands much more productively. In Morocco, the universal social protection reform now covers a full 32 million people, and the 2024 census has become the model for evidence-based policymaking. Tunisia's first digital geo-reference census marks a leap forward in data innovations and transparency. It's been used now to link up 600,000 children and informs most of the line ministries. Similarly, in Libya, the National Digital Health Blueprint. In Saudi Arabia, the partnership with the Saudi Food and Drug Administration. In Syria, a rapid head count. And in Lebanon, reinvigorating the health system through its digital platforms are all part of how technology has become not just a burden in our world, but really advancing how we make our decisions for the people. And across the region, I'm also happy to report that the age at first marriage has increased for both men and women, allowing them for opportunities for their family and employment. And we have also had a significant reduction in maternal mortality, greater investments in education, and increased GDP in nearly every country that is not in acute conflict. These achievements speak to a sustained investment in the health and protection sectors and renewed commitment across the region to act on that data to build resilient systems. The UN is keen to ensure that that results in every child being born out of choice and allowed to reach their full potential. I heard much of this reflected in the minister's speeches and His Excellency the Prime Minister strategy for Egypt as well. The UN has a Learning to Earning initiative that brings together 6 agencies and speaks exactly to that potential. And we try to work holistically with each of the individual governments, but also to be the connective tissue on South-South cooperation and greater partnership. With all of that good news, the paradox still remains, and the proliferation of conflict, both acute and protracted across our region, compounded by the risks that technology brings with it, climate change and the impact still that we face from COVID-19 have slowed and reversed some of those hard-won gains. I must say that although we use GDP, it also is a very poor indicator of equality. And unless we can look at the pervasive underlying factors, too many women and young people and other marginalized groups may continue to struggle to access quality healthcare services, especially reproductive services, protection from gender-based violence, and in addressing the maternal health issues that we are also keen to promote. Entrenched social norms and discriminatory laws continue to deny free and informed choice, and in the last 2 years alone have left the region with devastating challenges in Sudan, Yemen, Lebanon, and my own beloved Palestine. As we open this Congress, today we will not only explore the causes of this paradox, but also the pathways to reversing it by guiding the universal principles of human health, rights, and development. But beyond the economics, the crisis of social connectedness and a loss of the bonds that make society thrive is one of the biggest challenges that we face. If we lose human connectedness, we lose the heart of development. And every piece of research has shown that if we invest in human development, the individual, the societies that make up all of us, then it can lead to longer life, better health, and improved well-being. What more could we ask for? And conversely, I don't need to tell you of the detrimental effects of ignoring those factors. As technology transforms the way that we live and work, we must ensure it strengthens, but not replaces, the human connections that uphold empathy, understanding, and solidarity, including on how we deal with the intergenerational dialogue. The UN is working with governments and communities to change this, from examples that I can give you of midwives who I've met, who restore maternal care in crisis-affected areas, to the digital systems that you've heard very well elaborated, to ensure that medicines reach even the forest villages, social protection reforms that protect children, empower women, and provide security and dignity for an aging, growing population. For prosperity is not about wealth and material possessions. It is about the empowerment, equality, and opportunity, and the ability of one to fulfill their potential. Let me close, because I am the last speaker, and allow me to thank not only the government of Egypt for hosting for the third year in a row where I've had the privilege to speak, but also as a representative today to the UN Secretary General, and for the commitment that the United Nations remains steadfastly in partnering with each of you in this room. I thank you for your dedication to our shared values and to that connectiveness that will allow us to bring hope in this situation and to build a world where every person, wherever they may be and whatever their circumstances are, that they can live a life of peace, health, dignity, and prosperity. Thank you.
شكرا للسيدة الأستاذة ليلى باكر، المديرة الإقليمية لصندوق الأمم المتحدة للسكان UNFPA. في ختام هذه الجلسة رؤى عالمية حول السكان والصحة والتنمية البشرية، نتوجه بكل الشكر لكل السادة المتحدثين الكرام.
Speakers on their speeches, on their valuable ideas that they assured that the topics of health, population and development required a collaboration from all the entities in order to build a better future. Thank you so much. Thank you for your participation, and we are looking forward to continuing this dialogue towards a more human future. Your Excellency, the Prime Minister of Egypt, thank you so much for attending the conference. Thank you so much.
مش فاهمة ايه خلص؟
احنا خلصنا كده.